Hello everyone, welcome to the Voice of Homeopathy. Today we are conducting a webinar on autism, which is be presented to you by Dr. Fernando from Ontario, Canada, and he's already joined there. We are waiting for the participants. So many of the participants who have registered have not joined yet. So we are waiting for a few more minutes and we'll start soon. Okay. So until then, please stand by. Thank you. So I'd like to introduce Dr. Fernando here. Dr. Fernando is practicing since 2012 and he's trained at Canadian College of Homeopathy from Toronto, and he's trained in between 2009 and 2012, and he's a special pediatric physician, and he specializes mainly in the autism, developmental delay, behavior issues, speech delay, and other neurotic problems of the children. Okay, Dr. Fernando, can you unmute yourself and you can share your video and PPT also. We have joined you as host, so you can start.
Okay, can everybody hear me? Can you hear me, doctor?
Yeah, everybody can hear you, no problem.
Let me get my camera on and then we'll get started here. Yes. There we go. Okay.
So, hi, how are you?
Good. Nice to see you, Doc.
Actually, I also want to tell all the participants that me and Dr. Fernando also solve cases together also with difficult cases wherever I stuck somewhere or wherever he stuck somewhere. So we also share our cases and discuss it in person, so that so that the goal of every homeopath is that homeopathy should prevail. Okay.
Yeah.
So that's why we have conducted this webinar to spread awareness about the autistic children, the ASD, the spectrum disorder. So from now here, the Dr. Fernando will take on. And Dr. Fernando, please share your. I'll mute myself and I'll also put down my camera. You start your PPT also, and you can share your. Okay.
Perfect. Thank you, Dr. Devendra.
Okay, over to you.
All right. All right. Good evening, everybody. Welcome to the lecture. I'm excited to share with you guys today. I'm going to be sharing my screen soon, but I'm excited today to share with you guys kind of what I've learned through clinical experience. You know, the last, it's been 10, 12, 13 years now, exclusively on pediatrics with delays, especially autism. So this is going to be a lot of, I'll break down kind of what I'm going to go through. If we have time, we have to see how much time we have. If we have time, I want to share one case with you guys. I'm not going to go through too many cases. What I want to do is, this will be a little bit more advanced. I want to equip you guys with tools to kind of understand what to look for when you're taking a case of a child with autism, what to look for that are common and uncommon symptoms, okay? Because we have to know all the common symptoms. And if you haven't treated many children with autism, you may not know what is extremely common, and therefore you won't know what is uncommon to try to prescribe on, okay? Because as we know as doctors, with common symptoms, they're not as useful for us to find the remedy. We will litter our repertory chart with all these symptoms that will bring us nowhere, and we'll bring up all the polycrests and all these big remedies, and we'll be lost. So we're going to go through that today. So I want to talk about what is autism, common symptoms, uncommon symptoms, and I also want to equip you guys with tools. So the tools I want to leave you with is kind of how I do, kind of what I learned over all these years of clinical experience of taking the case of the child. Because what you'll see is many of these children, there's not a lot of symptoms. There's not a lot of characteristic symptoms. The cases are very dull. You'll hear the parents talk about the same core common symptoms of autism, which will lead us nowhere. So we have to do a thorough evaluations. And many times you will find one obscure thing or two obscure things in that child, many times during physical exam. Now, I do a lot of virtual consults, so I make sure to go through every absolute system of the body when I'm taking a case to get the parents to be my eyes and ears, because I can only see so much through the screen. but I get them thinking of what I'm looking for. And the littlest things could be the clue for this case where there is just all common symptoms, not a lot of characteristic symptoms. And therefore we have one clue that becomes characteristic and it guides us to a remedy. It leads us in the right direction. And then we give that remedy and we start to see slow changes, okay? So we will do that. Hold on. I'm going to, I want to make sure I make this full screen. Full video. Let's see like this. Okay. There you go. Hopefully everybody can see that, okay? So let's get started. So like Dr. Devendra said, me and Dr. Devendra have been colleagues and friends for many years now. I actually reached out to him years ago. It was probably 2017, and he was such a good doctor, and he was gracious to respond back to me, and me and him have been working together back and forth. He helps me sometimes when I have some difficult cases, and I've learned a lot from him. He's a very good homeopathic doctor. So I'm going to share what I've learned through him, and I'm going to share my clinical experience, and we'll go from there, okay? So let's get started here. I'm going to try to share my screen, and we're going to get started. So let's do this. Screen share. Okay. Actually, let's do this here. We'll go here.
Screen share is down there on in the just beside
Bottom.
your camera icon.
Yes. Okay. I see it, Doc. I think
Upside
we're good.
arrow.
Okay. How is that? Can everybody see that? Doc, can you see that?
Yeah, we can see that.
Perfect. Okay. So let's do this. Okay. So let's begin at the beginning. So first of all, I don't know how many of you have actually dealt with a lot of autism, okay? Autism is it's a neurodevelopment condition, okay? And there's a wide spectrum, as in its name, autism spectrum disorder, okay? So we will see children in the clinic. I've seen children that are severely delayed with a lot of self-injurious behavior. And I'm sure a lot of you have seen this also, but severely delayed, a lot of self-injurious behavior where they hit their heads, they bite their hands, they have, they get very aggressive and violent because of the discomfort they're in. And then we get the other end of the spectrum where it's simply, there's just severe developmental delays where the speech isn't there. They don't have any words. Comprehension becomes a little bit of a problem where they don't understand simple directions or instructions. So they may understand a simple direction like get your shoes. But if you say, get your shoes over there in the closet, put them on so we can leave, they won't understand 2 or 3 steps commands. So that's the more mild version of autism, okay? So let's do this. Let's go to our first slide. We'll start chatting here. First thing, so again, I really want to get down to the meat and potatoes, core things that you guys could take home with you today and start implementing right away, okay? So let's talk about this. Common presentations and symptoms that are of lesser importance to us as homeopaths, okay? And we know this, we learn this through you know, our training and our philosophy, but common symptoms are not important. They will lead you astray and you'll be lost, okay? So common symptoms that we tend to see when we have a child that's been diagnosed with autism or suspected autism, okay? So let's go through this. We will tend to see, and you may have seen some of these children in your clinic, but we will tend to see this thing, and parents will always complain about the main complaints, okay? They will complain about speech. They will come into you for speech, comprehension, and self-injurious behavior. So you will typically see those 3 main complaints, and parents will spend a lot of time on there, but we need more as homeopaths, okay? So let's go through this. So moving the hand in front of the face, spinning the hand. So you may have seen this, but what these children will do is, it's a type of stimming. And what they will do is they will put their hand like this, and they will go like this. This is almost all of them do that, or many of them do that. So you see them, they're looking and they're going like this, and they go like this. So this is very common. We'll see this type of stimming, and almost all these children have it. It's a very common symptom. Toe walking, hand flapping. I'm sure you've seen this. We got the hand flapping, toe walking, which is extremely common. Spinning and rocking. More extreme cases, what you will see is you will see these children. They'll be like this. When they're sitting, they cannot sit still. The restlessness and the need for motion and this hyperactivity is extremely common also. So many times these children do not stop moving unless they're in front of a screen or in front of a tablet, or they're watching a movie. So you'll see these children. This is what you'll see in the clinic. You'll see them. They're just going like this, nonstop, rocking, rocking, rocking. So very common, okay? Turning head sideways to look straight ahead. You'll get parents that tell you about this. They look out of the side of their eyes. Again, extremely common, not very useful in homeopathy, but you'll see these children, instead of them looking here directly at you, what they'll do is they'll go like this. It's just like this. So you'll see this where they don't look directly at you. And there are rubrics for this. You can use these rubrics, but these rubrics are not necessarily going to narrow down your remedy selection as much as you would think, okay? Because it's extremely common, again, for this condition, for this label of autism. So that's another one. The lack of eye contact is going to be a huge complaint with parents that you're going to see, and it's very, very common. Parents will tend to think that these children have hearing issues, and they almost all go get the hearing checked, and it's not a problem with the hearing, it's a problem in the mind, okay? So they don't respond to their name or questions, and parents automatically will get the hearing checked, and the hearing always comes back totally fine, okay? Chewing on things. That is a huge, huge thing. They always have fingers in their mouth, almost always, and they're always chewing on cords. They'll chew on plastic devices. Some of them have chewy toys, like a toddler would have to chew on. And these are children 7, 8, 9 years old that still do this, and they need this pressure to chew on things. So again, extremely, extremely common, okay? We have the hyperactivity. Like I mentioned, most of these kids, it's very rare you're going to see these kids just being calm, okay? Very rare. They're usually always moving. And of course, the main thing you're going to hear is lack of speech. They don't talk. They don't say any words. And parents will tell you, if I could just get them speaking, everything else will get better. And many times they don't want to tell you anything else, because for them, they've decided that if he could just communicate, if the child could communicate, everything will be fine, okay? So, but we have to get past that. We have to tell them, you know, we need a whole picture as homeopaths, the whole complete case to find the remedy that's going to fit that child. So let's move on from here. Those are common symptoms. Let's see here. There we go. And there's just one more page of this, some more common symptoms. You will see this. There's a rubric for this, as you guys know, under the male genitalia or female, where children handle the genitals. It's called handling the genitals. So these children, you'll see them many times when they come to hug you, they will press against their genitals. They desire that pressure on there. Or many times they're handling the genitals, or they're rubbing them frequently. Or you'll get parents that tell you that my child, he's always lying on the floor and he moves. Really, they're rubbing themselves, and it's a sense of stimulation, and it's very, very common. I do use this rubric, handling of the genitals. I do not use the rubric for masturbation, because most of these children are not, there is no erection with the boys. So it's more of just the pressure in the stimulation. I will use that rubric sometimes, but it is common. You should know that. Echolalia, the condition where they just repeat everything that you say. You say something, they repeat it. Okay, so this is extremely common, and it is a big complaint too with a lot of parents. We have constipation, extremely, extremely common. You almost hear this with almost all the cases. Diarrhea is actually more rare. We have eloping, where the children will say, or the parents will say, when we go out, I have to hold my child's hand tight or he will run off. He will run into the street. He has no sense of danger. In the classroom, if they're in a special class, they will run off. So eloping is a big complaint and common too. We get this sensitivity to high-pitched noise. Many of these children, you'll see them, they wear hearing protection. They wear headphones to block out the sound of high-pitched noises, because it will set them off. Many of them will get aggressive because of that. So it's common. Silliness, laughing as if intoxicated. We have rubrics for this, but this is, again, very, very common. I hear this every day almost, where parents will say they laugh for no reason. They're laughing like someone has told them a joke, and there's no reason for them to laugh. So very common. And we have the ADHD symptoms, again, that hyperactivity, okay? So this is just for, the reason I show you this is for parents and doctors. We have a lot of doctors here who have not seen a lot of this, have not treated a lot of this. And this is what you're going to see as a common presentation of it. Varying degrees. I mean, you get the aggression, you get the self-injurious behavior. You'll get these kids, I didn't put it on this slide, but they'll bang their head on the floor when they're told no. They will hit themselves in the head when they're told no, and they will bruise themselves. They will bite their hands. They will attack others, their parents, their mother, their father, scratch them. And we think of remedies like stramonium when they do that, but scratch them, attack them, pinch them. That is extremely common too, okay? So now that we know what the presentation looks like, I want to share, I want to get into uncommon things, what we need to look for. And then I'm going to teach you guys kind of how I take a case, what I look for to try to get the information I need, okay? So let's go to the next page. Okay, minimum symptom or characteristic of maximum value. I'm sure many of you have heard this, but the goal is we don't want 30, 40, 50 symptoms in our rep chart. That's just going to confuse it. We want the minimum symptom of maximum value. We want the characteristic symptom if it exists. It doesn't always exist, but if you could find something that is characteristic or stands out in that one child with autism that the other 5 or 10 cases of autism you already seen do not have, that is characteristic. That stands out. It has value. So you pursue that, okay? And sometimes you will get 2 or 3 characteristics that give us an even more clear image of the homeopathic remedy that's going to help them, okay? And it's never, ever the main complaint. As we know in homeopathy, it's almost never the main complaint. It's the other things that are characteristic. So teeth grinding, it's not as common. So you will get teeth grinding, especially during sleep or during the day. It is more important if it's during the sleep because it tends to be a smaller rubric, and there are some remedies there. Later, I should tell you, later we will be, hopefully we have time, we will be going through a couple rubrics that I put in a rep chart for us to look over, okay? And hopefully we have time for the case too, but I want to teach you guys some remedies also of how I see it with these children in clinical experience. Styes, reoccurring styes. Styes in the eyes. They've had them when they were younger. They keep getting them. Things like this. Sleep position. Some of you may know about this, some of you may not. Sleep position can be important. You know, does the child, the most important one, which you may or may not know, is sleeping in fetal position, knee to chest position, like a newborn baby would be. How they're on their abdomen, their head is on the pillow, or their head is on their arms, and their bum is in the air, their knees are tucked in. So they're sleeping like that cat position or that newborn knee to chest position. This becomes very important for remedies like tuberculinum, carcinosin, the nosodes, even metarrhinum. So that's important. We ask about that. Ingrown toenails. If that is common in that child, or they've had it before, or it's a real every couple of months, becomes important. That's unique, right? I've had children, I've had this many times happen where children, I ask about the hair, the scalp, things like this, and I will find out that they will have white patches of hair, a small little patch, maybe 20 hairs, 30 hairs, and it's very unusual, and it's a strange, rare, and peculiar in that case, and it has nothing to do with anything, but it is very unusual in that child. There are 3 or 4 remedies which I will show you in the rep chart, lycopodium, I believe serenum is there, but I've used it times and it's been successful off that. Changes have happened off of that keynote. Enlarged lymph nodes. So tonsils, adenoids enlargement is extremely common. Okay, I should have put that in the first chart, but that is extremely common. But when we start getting any other type of glandular swelling or lymph nodes, I've had children where there was no case, very, very little uncommon symptoms, all just common symptoms. And after physical exam, watching on the video, questioning the parents, the child will have lymph nodes that are enlarged, and they turn their neck and you could see it. Not painful. The pediatrician will tell them it's normal, but you could see it, and it's there, or on the back, you know, underneath the back of the head. So that's important. That's helpful. It's unique. It's characteristic. It's unusual, right? You don't see that in every child of autism. So things like this, okay? Let's keep going here. Obviously, the temperatures, you guys know this, modalities, temperatures, anything you could find, but like, do they get hot? Do they get cold? Is there abnormal sweating of the head when they sleep? We know silica, calcarb, other remedies. does their whole, I've had children where their whole body will perspire, but their head does not. From here up does not perspire. We have that rubric also, which is extremely, extremely helpful. So the temperatures are important. Teeth discoloration. We've had children where there was, again, just common symptoms, and we've tried a couple remedies, nothing's working. Then the mother sends me a picture of the teeth. They'll be almost black and yellow, and they brush them every day. And it's near the roots of the teeth, near the gum line, you know. And we get remedies like creosotum or other remedies like this that we kind of, that is a strange, rare, and peculiar. We look at that. We look at creosotum. We see if it's the personality and the behavior and the temperament of the child. We prescribe that, and we start to get changes. Okay. Spots on the nails. I'll show you the rubrics after. White spots on the nails. There's a rubric for that under extremities, nails, spots, white spots, I believe. And you will see there are some good remedies there in red font, in bold, silica, sulfur. There's some other ones, but it's very unique and it's very uncommon. Calcareous carbonic is in there too, I believe. Body odor. We know this. Underarms, feet, the perspiration in general. Birthmarks. When we see birthmarks, a lot of moles. When we see the cafe au lait spots or Mongolian marks or any type of these birthmarks, we start to think of remedies like carcinosin primarily, but even thuya, and there's other remedies, okay? And parents won't tell you. All this stuff, parents will not tell you. You have to do a thorough questioning to get them to open up and start talking. Night terrors, fears, fear of the darks, reoccurring eye infections where there's discharge. Oh, they always get reoccurring conjunctivitis. There's discharge. Okay, that's important. Recurring colds, vaginal discharge in little girls. Family history you're going to see is going to be super, super important. We're going to get into this next, but the family history, is there, oh, sorry about that. Is there a common family history of thyroid issues? Now, we'll get into this, but family history is important if there's a lot of it within the family history, multiple different people in the family, or if it happens at extremely young ages or younger than what is considered normal for that condition. So like cancers, reoccurring respiratory infections, like you don't see tuberculosis much anymore, but like reoccurring bronchitis, pneumonia, stuff like that. So we'll get into that. Biting of the nails, you'll see this, that's unique. Abnormal hair growth, you know, that's strange, rare, and peculiar, especially in children under the age of 9. You know, you'll see it under their arms beginning, before puberty, between their eyebrows. You'll see down the back of the spine, fine hair following down the spine, remedies like tuberculinum, and on the genitals. So carcinosin comes up for abnormal hair growth. There's a lot of remedies there. And then, of course, we have facial grimaces or tics. You know, you'll see these children smiling abnormally or to nobody, and you'll get tics in the cheek or in the eye, things like this. Okay? I just wanted to list some common things or some uncommon things that I tend to see a lot of over the last 10 years of practice, seeing these children, okay? In homeopathy, we don't really specialize, okay? There's not specialties like there is in allopathic medicine or Western medicine. But the only good thing about treating one type of condition is the main thing is you get to learn what is common for that condition and what is uncommon. And therefore, you know what is uncommon, okay? Because if we don't know what's common, we have a very hard time as homeopaths to seek out what is unusual, to prescribe on that as a homeopath for the strange, rare, and peculiar, okay? Let's go to the next page. How much time we got? Let me just open my clock here.
Well, Doc, we have plenty of time, and I think we have a paid version of Google Meet. So I think there is no time limit, only guest time limit is there, about 100. But I think we can surpass the 1 hour time limit, no problem.
Okay, good. I want to make sure. Okay, good.
We have only reached halfway right now.
Good.
We have it's like only 30 minutes since webinar. Okay.
Okay. Good. So I have time. Good. Okay. What do we need? So I want to leave you guys as doctors and students with tools, real tools that you could implement tomorrow in the practice. Okay. So what we need to look for while taking the case of a child that is especially nonverbal, can't tell us anything, and is autistic or has symptoms of autism and may not be diagnosed yet, okay? So, couple things. I break this down into 4 or 5 parts, okay? And I explain it to patients, to parents, as the child is a puzzle. Their case is a puzzle. In this puzzle, we have multiple pieces that will make up the whole case of that child, okay? And each piece is a symptom or characteristic. Each piece of that puzzle is a symptom or characteristic. The more of that we can fill in from all different avenues, because this child is nonverbal most times, they won't be able to tell you. The more pieces we could fill in, we get a clear image of that one picture, of that one homeopathic medicine that's going to get us started to get their healing going, okay? So that's kind of how I describe it to parents, especially at the beginning, because they get focused on, I just want him to talk. Just give me a remedy for him to start, for the child to start speaking. You know, give me a remedy just so he understands. If that could get better, everything else would get better. But that's how I explain it to them. So they start thinking of what I need, what I'm looking for as a homeopath to prescribe accurately. Otherwise, we'll prescribe 100 remedies and nothing will work, right? So, symptom picture of the, so we start with the current symptom picture. Everything now, what that child presents with, head to toe, mental, emotional, physical, okay? The current symptom picture. Number 2, symptom picture of the child's history. So everything from birth to current day, to today. So birth till now. We want to know any condition they have, anything they've gone through, any illness they've had, any surgeries that they've had, any medical interventions that they've had. Exclusive. We want it thoroughly gone through. We want them to really think about every tiny little thing, every reoccurring illness. Okay. After that, I to the symptom picture of the mother during pregnancy. Sometimes there is useful things there. Many times there's not a lot, but sometimes there is useful things. So if the mother during pregnancy, and let me say this, it is especially important if the mother had 3 children. Let's say there's 3 siblings, 3 children, and the child with autism, that pregnancy was different than the other 2 children. Okay. The mother developed things during that pregnancy that the other 2 pregnancies did not have. It becomes even more important. It almost becomes, in my clinical experience, symptoms of the child. So we'll see this with food cravings, food aversions. They got extremely hot and overheated, where before they were always cold, the mother, during that pregnancy. And the other 2 pregnancies didn't happen. Their feet would burn, you know, at nighttime. They'd be so hot, and they were totally fine with the other 2 pregnancies. So when we see something that stands out in that pregnancy that she didn't have with the other pregnancies, if we see things that are strong, many times you'll see that the child has those characteristics also, but they may not have told you. For instance, the child gets really hot and their feet burn, or the mother craved ice water during the pregnancy, which sometimes can be common, but the mother craved ice water during the pregnancy, and now the child, that's all he'll drink. The child with autism, he'll only drink ice water. So we start to think of remedies that crave cold ice water, right? So this could give us a couple more pieces of the puzzle. Family history with these children is almost one of the important things when we have a case that is not very characteristic, okay, and we have only common symptoms. So we'll get into this, but the way I look at it, and again, this is just based off clinical experience, take it for what it's worth, but I've been doing this for 10 years and I've seen this pattern work pretty good and be pretty reliable. So I first look at mom and dad, okay, the parents of the child. Health issues of mom, health issues of dad. Anything at all. Usually there's nothing serious. Usually they haven't had cancer, or they don't have thyroid issues. You have to be careful with thyroid issues because almost everybody's getting diagnosed with hypothyroidism. So we have to be careful. Almost everybody's getting diagnosed with some form of prediabetes or diabetes. So you got to be careful with that. We're looking for something that stands out. But many times I'll get parents who have had, mothers who have had breast cancer, you know, and they're only 40 years old. They've had breast cancer. Mothers who have had ovarian cancer. Fathers who have had some type of intestinal cancer where they've had part of their intestine removed because of cancer. I've had this. So when you see stuff like that, that's very, very unusual. And we use the rubric general family history, and you start looking up, there's a bunch of remedies listed under those rubrics. Okay. So, you know, we look for family history of cancer when you get a cancer thing like that. If there is any swelling of the thyroid, which you don't see too often, but or a lot of people in the family history have thyroid issues, and it's a big problem. We can look at family history of goiter. And I learned this from Dr. Devendra, which was so helpful. The whole family history and no-so thing, I learned a lot from Dr. Devendra on this, which was very, very helpful. And I've used what we've kind of talked about and learned from him, and implemented it and seen it be fruitful. So mom and dad. I will also get into characteristics of the mom and dad very briefly, but like, mom or dad, some of the same questions I asked about your child. Do you sweat profusely at nighttime? Do you get extremely cold? Do you get extremely hot? Do you tend to get itchy at any time of the day? Tell me any little simple things that happen to you, any little problems that if you could fix, you would like fixed. And they may start telling you, dad may say, I get super hot. My feet are always burning at nighttime, and I get itchy as soon as I get into bed. Okay. So we'll note that down. We'll think of the remedies just off the top of their head that come up with for the parents, if there's anything characteristic, and we'll keep that in mind and see if it fits the child. Okay. And the reason this tends to work sometimes is because if any of you are parents, you'll know a lot of times you have 3 children. One child might be exactly like their father, personality-wise, or physically might look like the father, or might have a lot of the same physical characteristics as the father, And another child might be exactly like the mother, completely different than the father, but have the same personality type, sensitive to animals and sympathetic towards anybody getting hurt or animals getting hurt, or a love for animals, So you see it in the mother, and the child may have that or may not have that. But, children tend to take on the personality types of mom or dad, or characteristics of mom and dad. So it doesn't hurt to get that information. It's good. Again, remember, we're getting information from all different areas to build a picture of that child's case that cannot tell us. Okay. And many times will not have a lot of unique symptoms, characteristic symptoms, because of the nature of this illness. The child is very muted and dulled many times. Okay. So that helps. So mom and dad, also the siblings of the child, if there's common things in the sibling of the child, that could be useful. But then I go to the grandparents and the aunts and uncles of mom and dad. So the child, the aunts and uncles of the child with autism, to be clear. So the brothers and sisters of the mother and father. Okay. So and as you go higher up in the family line, I feel like it becomes less important because it's more far removed from the child with autism, but could still be important. And it becomes important when you see, the main thing is you see reoccurring conditions that mom had, her brother had, mom's mother had. So the child's grandmother, the child's great grandmother. Okay. When you see, oh, she had cancer at 40 years old. My sister had cancer at 40 years old. My mother got cancer at 60. My grandmother died of cancer at 55. Okay, you better start thinking about that. This person, and then the dad says, I had a heart attack. And we have to be careful around COVID time. There's been a lot more heart attacks and things like this and strokes. So we have to be careful between 2021 and now that we take that with a grain of salt. But prior to that, there's a lot of heart attacks. We think of remedies like Meterinum, which I also learned from Dr. Devendra, but history of heart attacks, okay? Which we'll get into when I show you the rep chart. So just exhaust it. Exhaust the family history. You're looking for clues. And as homeopaths, this is going to take time. These cases are difficult in my experience. They're about an hour and a half, my cases. But if you don't get all the characteristics of the case from all these different avenues, I see this all the time. You will get many homeopaths who will just give 6 remedies in a week, 1 a day. They'll give Burrita carbonica, they'll give silica, they'll give thuya, and they'll give it. Day 1, we give a dry pill of silica. Day 2, we give a dry pill of Burrita carbonica. We as homeopaths, we have to be careful that we don't start prescribing like this dogmatically, without a reason and without guidance and observation and watching. Okay, so that's what I would say with that. You don't want to guess. You want to do this right. You need to give it time. Okay. That's pretty much it for the family history. Uncommon symptoms of the patient are the most valuable in medicine selection, like I mentioned before. Okay. Minimum symptom of maximum value, basically. Think about that. You're not always going to get it, but if you get it based off all these factors, it helps us. All right, let's move on to the next page. Okay. I want to get you thinking of how I take a case, what I ask, what I look for. Again, a questionnaire, your intake forms are going to be very good for this. It gets them thinking about what you're looking for as a homeopath. If you don't already have it, put a good questionnaire together to get them thinking. Okay. Questions areas you should be asking about in case taking is many times there will not be many strange, rare, and peculiar symptoms. Okay. There won't be unless you do a thorough investigation. So it's usually broken down in those 4 ways from the previous slide. Current symptom picture, case history from birth up until now, pregnancy, and then the family history. Okay, kind of those factors, those 4 factors are usually the way I go. Okay, so as homeopaths, we know, always let them talk about their main complaint and why they came to see you. We have to hone the parents in if they keep going on about the speech delays and how he doesn't talk, and if he could just speak and he has a couple words, and on the comprehension and this type of thing, because that is their main focus. That's what they're going to focus on, and it's not helpful for us. So you let them talk about it, but if it goes on for 10 minutes, 15 minutes, 20 minutes, it's a waste of time, and we only have so much time per patient, and we want to get as much information as we can. So if that happens, I just tell them, okay, I understand that. Let's move on from that, because I understand about the speech. I want to know more. I need to know more to get your child better and to find the right remedy. So I want to start talking about other things. What else is there? What else is going on that stands out to you? Okay. So just keep things moving. Appetite. We always ask about appetite in every case, but some children will be have a very low appetite. They're almost all extremely picky, 4 or 5 foods. I should have put that as a common symptom now that I'm thinking about this, but very picky, 4 or 5 foods, okay? Or they have a huge appetite. You'll get children where they have a huge appetite, but they don't put on any weight. They're always eating. They're always in the fridge. We think of remedies like tuberculinum. Thermals, the temperatures, how the child reacts to conditions, weather conditions, temperature conditions, things like this. We talked about this. You may have to give them suggestions. We don't want to lead them, but we want them to get them thinking of give us ideas. Are they hot? Are they hot? Are they cold? Do they want the air conditioning on all the time? Do they need a fan blowing on them all the time? Do they want the window open when they're driving in the car? Or do they like to be outside in fresh air? You know, they always want to be outside, and they're just better. Their mood's better outside. Everything's better outside. Do they refuse to keep clothes on? Do they refuse to keep the covers of the blanket on at nighttime? Shoes, socks and shoes. Do they refuse to wear socks and shoes? You know, we could use rubrics like extremities, burning of the feet, or extremities, heat, uncovers, or desires to uncover. We'll go through these rubrics. But you have to get them thinking, and parents accommodate these issues with children. So sometimes a child will not sleep at nighttime unless they have a fan blowing on them, or the fan on the ceiling on, or the air conditioning blowing on them. And parents won't tell you this. They'll say, oh, they're fine. They sleep fine with the blanket and whatever, but yet they have a fan blowing on them and they have the AC blowing. So then you have to question this. And then you say, okay, well, what happens if you don't put the fan on? What will happen with that child if you don't turn the AC on? Will they still sleep? What will happen? Then they'll tell you, oh no, they'll start sweating from the head. They'll start sweating profusely from the head as soon as they fall asleep, and the sleep will be all disturbed. Okay, now you got a symptom. But they will accommodate with things. They'll do this with magnesium also. Everybody's on magnesium now. So to get children to sleep. And it covers the true symptom picture of the child, So you ask, what happens if you don't give them magnesium? What happens if you don't give them that melatonin to sleep? What would happen? What time would they wake? How long would they be up for? What would they do when they're awake? Okay. So anything, when you're asking this, you got to make sure that they're not trying to get rid of the problem by something else, therefore covering the natural symptom expression of that child, because then we won't get our true symptoms. It's no different than a drug covering a symptom. Okay. So that's the thermals. Cravings, we know this, but what I've found, food cravings are always important, but what I found particularly interesting with these children is salty, sour. So mainly what I tend to focus on, citrus and oranges, especially oranges. You'll see there's a rubric, but I've confirmed many times that orange juice, you got to make sure it's not a sugar craving, but oranges and orange juice can be a very strong indicator, mainly for Metarhinum, but also Lycopodium. But I've used it many times with one or two other points of that remedy or characteristics of that remedy in cases and had good results. Sometimes that was the only thing because I had nothing else to go on and we had good results. So when you see oranges or citrus, think of Metarhinum. But food cravings, okay? Onions. If there is a strong craving for raw onions, sometimes if I don't have a very good case, I will get parents to test things. What happens if you give him orange juice? Does he go crazy for it? Does he like it? Will he not stop drinking it? What happens if you chop up raw onions in a salad? Will he eat them? What happens if you leave him on a plate? Will he eat it? Will he like it? Or will he just spit it out? Some kids will eat an onion like an apple, a raw onion. It's unusual. It's strange. It's peculiar. Remedies like Thuya I've used many times based off that, you know. So we want to see, what do they tend to eat that is unusual? Ice cubes. Many kids, ice cubes. That's unusual. Ice cold drinks. That can be unusual. Okay. Milk. When you get parents that tell you organically without you leading them by asking them, when they say, oh, he needs, you know, he drinks so much milk and he just loves milk. And then you ask the temperature of his milk. What, you know, does he say anything about the temperature? Does he need it a certain way? Will he not drink it if it's a certain way? Again, you don't want to lead them, but you want to get them thinking. And they'll say, oh, he needs it. He needs it ice cold. It's got to be ice cold. I've had parents tell me where they put ice in the milk. And we think of remedies like tuberculinum. You see there's a rubric for that. But it's unusual to want ice cold milk. Okay? So what I want to get you thinking about is every section, aspect, area of the child, mentally, emotionally, and physically, I am just going through it so thoroughly. Because if you don't get stuff, it's going to be very hard. It can be very, I shouldn't say it is. It can be very difficult to get symptoms you need that will give us something of substance, something of characteristic value to guide us. And if you don't get it, many times you'll fail the patient and they'll say homeopathy didn't work. And, you know, listen, I get cases like this where 10% of the cases are difficult and we don't get it, 10, 15%. And we don't, you know, it's tough. We're trying some remedies, but many times we'll get stuff, at least one or two things that will lead us in the right direction. Okay. So make sure you thoroughly exhaust everything. As homeopaths, we don't give up. We never give up. If these parents are desperate, there's no solution for these children. There's nothing to help these parents. And it's extremely difficult for these parents. I don't know how many of them do it, but they do it. They're good parents. And so we can't give up as homeopaths to try to help them and to make their lives a little bit easier. You make a little change in this child, and it's a huge change for this family. If they start hurting themselves, or they start eating some new foods that they wouldn't eat before, or they don't elope and run away now. The smallest thing for us as homeopaths is huge for these families with autism. Okay? So don't give up. Skin, we talk about skin. Obviously, itching, rashes, eczema, moles, warts, cracks, birthmarks, dark colored spots, you know, the cafe au lait spots. Ask about everything, and you ask now or in the past. Has there ever been anything in the past or now like this? And they'll start talking. Nails, are they thick? Are they thin? Do they peel and exfoliate in layers? There's remedies like calcarea carbonica and other remedies. Do they crack? Do they get splits in them and crack? Ingrown toenails, it's more common than you think. We see it so often, and it leads us to some remedies. Okay, so ask about that because they won't tell you, or ask them if you know there's redness or inflammation or the signs of ingrown toenails around the toes. Okay, ask them. Let me see, we're at 42 minutes. Okay. What else? Sleep. In sleep, a lot of these children tend to have sleep issues. So insomnia is common, where they're up and they'll be up for 1 or 2 hours in the middle of the night, then they go back to sleep. Sometimes they wake at 4 a.m. and they're up for the rest of the morning. This can be common, but if it's a common time, it's always at 3 a.m. Look that up. You know, sleeplessness at this time. Okay, use it. Sleep, I asked them, does anything happen in sleep? Tell me about anything that stands out to you or that happens in sleep. And I may have to give them some examples, but I try to let them just talk. So we're looking for sleep position. It can be very, very important. Does a child sleep with the hands behind their head? Do they sleep in that, especially in that knee to chest fetal position? Very important. Do they always sleep on one side no matter what? It's got to be characteristic. It's got to be strong where it's frequent and it's all the time, right? I should note the sleep position. If the child is a year old, if the child is a year and a half old, 2 years old, and they sleep in that knee to chest position, that is common for that age many times. So that symptom is not as useful now. You're always looking for what's uncommon. But if that's happening, they did it at 1 or 2 years old, but it's happening at 3, 4, 5, 6 years old, and that's usually how they sleep for a period of time in the night. Now it's unusual. We use it. Okay. Grinding of the teeth during sleep. We ask about that. Is there any nightmares or screaming or fears at nighttime? Fear of the dark. Drooling. Do they drool? Things like this. Okay. We talk about the lungs. Is there any respiratory issues? Have they had asthma in the past? Are they prone to, like I mentioned, respiratory infections of any kind? They get it over and over and over. Think of remedies like, there's a bunch of them, phosphorus, tuberculinum, things like this. Do they get out of breath easily? Where they get winded, like calcarea carbonica going up a flight of stairs and they run out of breath, right? So things like this. Digestion. How's their digestion? Do they get gas? I just ask them, tell me about the digestion. Is there any gas, bloating, constipation, diarrhea, distension of the belly? Anything that stands out to you, I ask them. And they'll start talking to me. So we're just looking for anything abnormal. I also ask, I'm not sure I put in here, but I also ask physical observations of the child before I see them, and I get them to send me pictures and videos of the child. But does anything stand out to you about this child when they were born or now, that anything in their body that is disproportionate or anything larger or smaller that seems disproportionate that a pediatrician thought was unusual? How is their size compared to other children their age? How's their height, their weight compared to other children their age? We're looking for anything that stands out. Some will say, oh, their head was so big when they were born, they actually they checked and they were concerned about it. Then we have the rubric of head enlarged or large head, right? Brings us to remedies like silica, burita, calcarea carbonica. Large head, distended belly. Again, we got remedies like silica and calcarb, things like this. Okay, but get them to tell you, and they will tell you if it stands out, and then you confirm by looking at the child. All right. There's that. The stool, we ask about the stool. Is there anything abnormal about it? Colors are important sometimes. There's usually not a lot there. The personality, as you know, can be very, very important. It could differentiate a remedy of, burita carbonica to tuberculinum, right? Like just by the personality type. So is a child extremely extroverted and going up to strangers and waving to strangers and sitting on people's lap and just likes to go out? Or is a child scared of strangers, or if someone comes in the house, they're like burita carbonica, where they hide behind the mother, or they bury their head into the mother's shoulder or her leg, or they hide behind a piece of furniture. So two extremes, but you want to see, how do they react to stimulus like this? How do they react to their environment? Okay. Perspiration, we talked about this. Question perspiration, where it happens on the body and when it happens, in what circumstances. So during sleep, hands, feet, mouth, nose, great rubric, tuberculinum's there, but perspiration of the nose, I've had this before and it was very good. So just question everything and have your ears open, because write down everything they say. They will say things in passing. Write it down. Oh, he just, I'll be asking about sweating. They said, he sweats a little bit on his head and he sweats a little bit there, but he tends, and he gets some drops of sweat on his nose, but that's it, they'll say, and it's not a big deal. They'll say something like that, but they told you that he sweats from the nose. You write this down after you go back and you get them to thoroughly explain it better, and you see if it's strange, rare, or peculiar. Okay. Water, do they love it or hate it? Infections, ask about reoccurring infections. Family history can give an idea into miasms, which we talked about, the gestures. Okay, what you see. I'm just seeing some of your messages. We want some cases. I will share a couple of them with you guys. Okay. Let me talk about this for you guys. This could be very, very important, okay? the importance of, it's called cease therapy to authopathy, where we use, this is not classical homeopathy, but it's been very helpful for these children, where we get, if we suspect the child changed after any vaccinations, where within a month of vaccinations, they lost eye contact, they stopped talking, things like this. Many times we will get that exact same substance, that exact same vaccine from the homeopathic pharmacies, give it in split dose, and you will see many times changes. Sometimes it will do nothing, many times you will see changes. There's a pharmacy called Helios Pharmacy in the UK, which carries all these, okay? So that is something you guys need to pay attention to and think of. Let's move from there. What we can do is, I want to go through some remedies. Actually, why don't you guys, in the question box, if you guys want to see some remedies and what we look for, just let Dr. Devendra know and he will let me know. We could share a couple of cases also, just to give you an idea. Okay, so just let him know what you guys are thinking, and we'll go from there. And then also the rubrics, we go through rubrics also. Okay, let's do this actually. So sulfur, I'm going to quickly go through these for you so you just have a little bit of ideas. You guys already know these remedies, but we have a strong aversion to water. We have a strong craving for sweets that's different than other children their age. It stands out. They tend to collect many things. You will get these children that collect sticks, rocks, wrappers, garbage, things like this, which becomes very, very common, okay? They're very hyperactive also. Sulfur, as we know, has the heat, okay? They tend to run very warm. They tend to refuse to wear socks or shoes. Itching, especially when they get in bed, is a huge, huge thing. Rashes, when you see rashes on the anus, the bum, the perineum, anywhere down there, think of sulfur meteorinum. Very, very useful. It's a very big indicator. They could have red lips like tuberculinum, very prone to constipation or diarrhea. Could be either. And we get itching. These children will pick their nose, itching of the ears, itching of the bum. They're always itching their bum. Okay, so just some characteristics. Next, calcarea carbonica. We have the sweating. Strong rages and temper tantrums where they fall to the ground when they're told no. Okay, they bite, they scratch. Prone to night terrors. A lot of little fears and anxieties. Okay, they're very clingy. Everything goes in their mouth. These children, they sweat from the head, which we know. They tend to be very overweight, which we know. Reoccurring infections. And everything else you guys pretty know. Another big indicator I use often is this obstruction of the nose at nighttime in bed. Lycopodium, calcarea carbonica are two big remedies, and it's a key indicator. Lycopodium, I use this remedy a lot. Look for the time aggravation, 4 to 8 p.m. They tend to be irritable and angry. These children will be angry and get aggressive. There's a rubric, waking up in the morning, on waking in the morning, tuberculinum and lycopodium are huge indicators, okay? Lycopodium gets irritable and angry 4 to 8 p.m. If you see anything 4 to 8 p.m., think of this remedy. They're very bossy. They could also be very clingy also, okay? So you guys know this remedy, but I just want to give you a couple keys. They hate cold drinks. This has been a key with children with autism where the parents say they will never drink any ice cold water or cold drinks. Okay, so we think of this. They'll only drink at room temp. Tuberculinum. These children, when you hear that the children hurt themselves and hit themselves in the head and bang their head on the wall or the floor, think of this remedy, especially when told no. Tuberculinum is a big indicator. They grind their teeth in the night. They have a lot of fears at nighttime. They're prone to respiratory infections with them, or especially in the family history. They are destructive, okay? And they're extroverted. Think of these things. They sleep in that knee to chest position again at nighttime, and they tend to sweat from the head. You get a combination of these factors, this is a good remedy. Big appetite, which I mentioned. Thyroid issues in the family history, it's an indicator for this. Enlarged glands, we talked about all this. So I just want to share a couple remedies, okay? So you have an idea of what we look for. Key pointers. Even if you're treating virtually, you must do a complete physical evaluation for clues, okay? the hair, the face, the body, the size of the head, the size of the belly, the skin, birthmarks, everything, head to toe. I know some homeopaths say it takes months to see changes. From my experience, within 7 days on a good remedy, there's usually at least some small changes noticed. 7 to 14 days, there's at least some small changes noticed. But you have to inquire. You have to go through what they told you and what you see now. Okay, so that's important. But you know, it doesn't take a month to see a change. That's very rare. Okay. Do not forget, like I told you, tautopathy or seized therapy for vaccines, antibiotics is very powerful for these children. And don't give multiple remedies daily in dry pills or the dry pellets dogmatically. Okay, we don't want to do that. These are other common remedies we use. Okay, the no-sodes are huge for these kids. With no-sodes, and me and Dr. Devendra, I learned a lot of this from Dr. Devendra. You want, usually high potencies are more beneficial for these children, 1M, 10M or up, but I usually start around 10M. We had a case that me and Dr. Devendra worked on at one point where tuberculinum seemed like the remedy. This child was like 4 years old, had severe developmental delays, and was not walking yet at 4 years old, was crawling around, was not able to walk. I prescribed a remedy, tuberculinum, I believe in 200C or 30C, and I believe we did 1 or 2 doses, nothing changed. Me and Dr. Devendra spoke. He looked over the case, and we both decided that, and under his guidance, that let's give it in high potency. We gave 1 dose of 10M. Within 4 days, that child started walking. You know, you get miraculous cases like this where that will happen, where low potency will not do it, but high potency will do magic. So since then, I've used many of these no-sodes in high potency, and it makes a difference. The potency selection makes a difference. 1 dose, high potency, wait 2 weeks, you know, 7 to 14 days at least. Longer is better. Okay. Let's see what else we got. Good. We're at the end. Okay. So why don't we tell me how much time we got? Let me see where we're at. And if you guys can let Dr. Devendra know through the chat.
We have time. No problem. You go ahead with your.
Okay. Doc, let me know what people are saying as far as kind of a couple more things they'd like to know. I will go through 1 or 2 cases, but let me know any other questions, okay?
Queries, nobody has given anything until now, but I think you should move on to some cases. So they all must, they are all practitioners. So they must be eager to know some of the cases and the results. Okay.
Okay. Let's do that. So let me do this. Okay, let me open this. So let me get this open for you guys, okay? And we will do that. I'm just going to show you cases directly from Radar Opus, okay? The spelling may not be perfect. Like you guys, I'm typing very quickly as I take this, but I want you to get a general idea of kind of what I look for. You will see in these cases many times I do not write everything out. I'm asking all those questions, but if there is nothing there, I'm not putting like perspiration, nothing. I'm not even listing it. But I ask all the questions. I'm only writing down things that are useful so I don't get 4 pages of notes, of case notes, okay? And I do not even put all the symptoms in the rep chart that are common. For instance, developmental delays, mind developmental delays, mind talking delayed, things like this, because again, it's going to give me some of the common remedies I already know. I'm putting in some things that are a little bit more strange. Let's do this. I'm going to show you this case. Let's share this with you. And if you guys can't see this, just tell me, but you should be able to see my screen here now.
Yeah, doctor, we are able to see the screen. No problem.
Okay. So this remedy that I prescribed for this child, this is a 3-year-old child, speech delays, throwing things, all the symptoms of autism has not been diagnosed yet, okay? I was suspecting there was a lot of antibiotics use, and there was changes within I believe it was a couple of weeks. I can't remember. We'll see here. But after vaccinations, after the childhood vaccinations, the mother noted things changed. So we look at, again, tautopathy is always a plan B and something to think of, okay? This remedy I prescribed was silica 30, and I gave a single dose of this. I didn't repeat. With silica, I don't tend to repeat often. It's a slow-acting remedy, as you guys know as doctors. So this is the case notes from what the mother told me. You're going to see there's a lot of stuff that's not important, okay? So she says, I said, tell me about the speech. She said, he can identify all the colors and shapes of the dinosaur. He will say everything. Will understand putting on your shoes. Let's go to their grandfathers, okay? If you ask him, what did you do today, or how school was, or how are you, he's not able to answer that. He doesn't understand, okay? So they're not conversational. Learning and comprehension. She has him in speech therapy 2 times a week. He had a really good session, but the learning and comprehension are a big issue. I asked, how is his personality? Tell me about him a little bit. Now you can see what we're getting here, okay? Not a lot of this is characteristic, but you're getting some things. He's a happy-going kid, she says. He is loving. He loves to play on his own, but he always has issues with transitions, Mom said. He gets better. It's been a little bit better recently now. That's better now. He would freak out if transitions would happen. So that's going from one classroom to the other, from leaving speech therapy to coming home into the car, going to the car to come home. This is what she means when she says transitions. He would freak out. Sometimes we'll go to the ground and cry. At least one. I said, how often is it happening? She says, it's still happening once a day, she says. At school, he will kick and scream if he doesn't get his way. Again, told no or denied. Like a child is playing with his toys, and he will throw the toy at a child and have a tantrum, okay? Tantrums will be when you tell him to stop doing something he likes that he's doing. So again, told no or denied. This is when they get the reactions, okay? It will last. I said, how long does it last? It will last a couple minutes max, and then he'll get over it, she told me. He has a hard time playing with other kids. The school teachers said that also, okay? I said, is there any fears? No fears, nothing there. Hobbies. I said, what does he like to do? What makes him happy? He loves to be outside. He loves it. Summer, in the winter, he loves it. He's an outdoor kid. He loves the water. He takes swimming lessons. They went to the ocean in Italy when they were on vacation, and I asked about the car ride. I specifically asked about that. So I noted when I asked directly a question, I note it because it has a little bit less value when I ask directly and they give me the answer I want. But he loves the car ride also, she says. I asked him, has he ever had any rashes on his bum or anything like that? She says, he never liked his bum change. It was more before, she says. Sometimes his anus will get red after sitting, and he's been unchanged for a while, okay? Food. Tell me about food. He's a good eater, so this child is not picky. He eats everything. He loves meat, she says. So that's kind of interesting. He likes meat. Thirst. She says, is there anything unusual with this thirst? You have a high thirst, low thirst? Does he crave a certain temperature of water? She says, not really. It's a normal thirst. So then we don't put nothing there. Digestion. Great digestion, goes to the bathroom twice a day, a bowel movement twice a day is totally fine, no constipation, no unusual colors, no diarrhea, okay? Skin. So tell me more about the diaper rashes. When he was younger, he would break out from with a diaper rash. We get it once a month. It was a bad diaper rash, and it happened until 2 years old. On his arm, he has a light brown spot on his arm, she says. So again, that cafe au lait spot, okay? We think of carcinosin, right? Learning, dresses himself. He has problems dressing himself. He is potty trained. Opening a cup is a problem, and putting the cup to his mouth is a problem, okay? Likes music, nails. She has to cut them often. That whole case, I'm going to tell you, there's not a lot there. There's a little bit. We start thinking about the personality type, you know, phosphorus, silica, things like this. The diaper rashes, we start thinking of sulfur, metarhinum. Everything came from the family history here. I asked her, tell me about the family history. She says, I've had ingrown toenails, 20 years of this. She says, I actually had surgery for it because it was so bad. And she says it would be red. I said, what would happen? She said, it would get red and painful and hurt. Dad's younger brother needed surgery also. So the father of the child also needed surgery. 2 of Dad's brothers. So you're seeing 3 people now, the mom, In the extended family on the paternal side, the two brothers needed surgery. Both needed surgery, and the toenail would get infected. It would actually get infected and discharge pus. Every mom had surgery with it. She told me something else. She said, Dad had kidney issues 15 years ago. It's in remission now, prone to kidney stones. That could be important. I didn't use it, but that could be important. Mom goes to bed hot and wakes up cold. Okay, so here we get this family history. This was the clue for me. This is what actually helped me find the remedy silica, why I selected it, and we prescribed it. And then you'll kind of see the changes that happen. And we're still in progress with this case, but there's been some good changes. I said, physical, tell me about physically. What is he like? How's his build? She says, he's tiny for his age. He's petite. He's lean. He had a really, she told me this on her own. I didn't ask directly. She said he had a really big head as a baby. The head grew so much. Both my in-laws and my mother said it was big. Bigger head on a small frame. He was a tinier, thinner child. Okay. So again, we're thinking calcarb silica then. So we have two keys now. We have this ingrown toenail, and we have a family history of ingrown toenail, and we have the big head. Temperature. I said, tell me about, how does he run? Is he hot? Is he cold? Does he refuse to wear certain things? How is he at nighttime in bed with his temperatures? She says, normally not hot or cold, or not cold, not hot. He hates socks after I asked her directly. As soon as he gets home, he'll rip them off. Sometimes he likes to take his pants off. That's it. Sleep. He sings sometimes in his sleep. He's happy. He lies on his belly. A little bit in fetal position, but she's not 100% sure. Ear infections. She told me how many ear infections he's got. Okay. He would get them all the time, a couple a week. A lot of antibiotics. Animals. I said, does he love animals? Does he hate animals? Is he affectionate to them? How is he with them? Does he have any fears of them? Says he loves them after I asked directly. He likes dogs, but it wasn't too strong. I didn't think it was very relevant because she didn't say, oh yeah, he loves animals. He just loves dog. Every animal. He's got toys that are animals. He watches animal shows, cartoons. Okay. So there you go. We have all this, the vaccines, that. So I prescribed that remedy. Now you'll see kind of after we give this remedy, this child started talking more. The temper tantrums went down, and this got better and better. We gave 1 dose of silica, and this was a week ago. They noticed a little bit. Now, they're not going to tell you everything's gone, but there's been changes in 7 days. They noticed a little bit. He's more attentive, they said. I said, tell me what you noticed. He's more attentive, more words coming. They're coming out clearer. It's not like she says, it's not like, oh my God, like a big drastic change, but a little bit. He's less throwing the toys. So the tantrums are coming down. Less throwing the toys, less than before. The throwing was less. The best day was after the dose. He had a little bit of a running nose, but it went away the next day. Throwing. I said, tell me about the throwing. Is he still doing that? She goes, before he was throwing 10 times a day. Now it's only 5 times a day. So it got significantly better. Tantrums. They have been less the tantrums. Before it was 3 or 4 of them per day, and now there's only 1. And that's been 1 time since we gave the remedy. It's not once a day. It was 1 time. So you could see, talking. I said, how's the speech? Anything happening? This was last night. He said that this is my rhinoceros. He likes dinosaurs. And Dad said he was more attentive to things. Okay? So we decided to wait. We didn't redose there. And we just kept going like this, and there was little changes. We redosed. There was some more changes. We redosed again 2 weeks later. Dosed on the 24th. He was sick before. Then Boxing Day, he got better. Lots of new stuff, they said. He got his pants wet, and he said, my pants are wet. This child's starting to talk after silica. He's easier going. The past week before this was difficult. So he needed another dose. We didn't give it yet. But the talking comes in. The tantrums get better. Okay, so this is what you could see based off the large head and based off the ingrown toenails, the history of that. Okay, now let's look at the rep chart here. You'll see I didn't edit this, change this. This is exactly how we took it and how we did it. Okay, just so you could kind of see the symptoms I use. Let's go here. Let's open this up and let's open this up. I did in this case put arrested development in children of mind in general. Okay, desire for music. I thought that was important. I put it in. Complaint. Now there is no family history of this under general. So I just used the rubric, taking the case of the family history like this. I didn't have a lot to work with. I did this to see if it brings anything close. You could try different things on different clipboards. So I put this and this in here. And this was the main thing that led. This love for animals is there also, okay? But silica is number one. I gave silica and those changes happened, okay? That's a case. So you can see kind of...
I apologize to interrupt.
Okay.
We have, I think we have to wrap up in next 15 minutes because we have already been 1 hour, 15 minutes, and our
Yeah.
kind audience is still with us and they are holding on. So
Good.
I think 1 hour, 30 minutes is enough for that.
Good. We're almost done. Okay.
Yeah. Next 15 minutes we'll wrap. Okay.
Okay, good. So that's the main case I wanted to show you guys. Here's what I want you guys to do. Just mention to Dr. Devendra if there's, because I think we should do question and answer soon. So we have at least 10 minutes for that. I want you guys to ask any questions that you have, you want to know more about, or anything that I can answer for you guys. Okay.
So first of all the participants, Dr. Fernando has given a lot of credit to me, but I tell you, it's his greatness, and we all learn from each other. That is, we all homeopaths should do. And you see, the reason for me for getting a lot of international patients, the all referral comes from Dr. Fernando. So I give all, making me as an international doctor, the all credit goes to Dr. Fernando, because he is a very kind friend of me, and wherever he gets stuck, he's a very nice person. Wherever he gets stuck, and humble, so that okay to accept that. And I also somewhere when I stuck, I take his advice. So that needs a lot of greatness, and he's also giving a lot of credit to us. So that shows his the personality he has, the great.
Thank you.
Doctor, also tell us if anything like any rare remedy or any particular experience of your lifetime that is like embedded in your memory timeline, that was a wow case when you got that.
Yeah. Okay, that's a good question. To be honest, when I worked with you with that tuberculinum case, that was a big thing. It showed me the power of higher potencies, especially with the nosodes, where this child started walking within 7 days of tuberculinum 10M. That was huge. But many of these cases, there will be slow, gradual improvement. It's not always going to be like you give a remedy and then there's huge changes. It does happen. If you have strong characteristics, it will happen. But that was a very good thing. We had another case of autism, and alumina was the remedy. But one of the characteristics of this case was the child would urinate when he was passing stool. And it's a key symptom. I forget the exact rubric, but it's a key symptom of aluminum. And the child had constipation when he was urging for stool, I believe it was. The constipation went away and this child started talking. So again, it's no different than any other case we do, where we look for the characteristics of that case and we prescribe on it. But you'll see little things like this happen all the time as you prescribe. Okay. I put this together. I wanted to go through this before we get to any questions of some of the rubrics that we tend to see that we discussed a little bit. Okay. So, this rubric here, I don't know how many of you have seen this, but behavioral problems in children, where these children are good with strangers outside of the house, but they're not good at home. They're irritable at home. They're angry at home. Their behavior is bad at home. We see this very, very common. Remedies, Thuya, Lycopodium, tuberculinum. This has been a great rubric to use. Okay, so keep this in mind. The irritability on waking in the morning. This is, I told you, tuberculinum and Lycopodium are the two main ones I look for. If I see evening aggravation in the case in any way, or gas in the evening, 4 to 8, and the waking up with irritability in the morning, I think of Lycopodium. If there's hitting of the head, grinding of the teeth at nighttime, maybe a little bit of sweating of the head at nighttime, I look at tuberculinum. But I've used that many, many times. The discoloration of the anus, the red anus, which we talked about. The sweating, offensive perspiration under the arms, of the feet, we talked about. This is a good rubric. I've had this many times in the more recent times, 2-3 months, where we get The mother will tell me that the whole body sweats, but the head does not. Okay. Thuya was a good remedy for this. But general perspiration except the head. Very important. History of ingrown toenails. The white spots on the nail, like I talked about, silica, nitric acid, sulfur. Okay. Remember I told you this? Ask to see the nails. You'll see a bunch of little white spots. The parents will never tell you this. You have to ask. And they'll say, oh, yeah, they get white spots on their fingernails. So sulfur, silica, things like this, okay? Calcarea is there, but not that big. Family history. This was, again, Dr. Devendra really showed the importance of family history to me, but cancer, okay? Respiratory complaints, recurring bronchitis, pneumonia, if there is tuberculosis in the family history will be important. This is remedies like tuberculinum. Heart disease, medarinum, okay? Goiter, thyroid issues, tuberculinum. History of insanity, addiction of any kind, suicidal tendencies, carcinosin, syphilinum. Think of those for these kids. And this is there's one more chart off this I want to show you. So personal history of recurring styes in the eyes. This becomes important. Look, silica's there, serinum's there, sulfur's there, graphite's there. This for carcinosin. The child, you will see this. Again, it's not important if it's in a child that's 1 or 2 years old, but 3, 4, 5 years old, the child needs to be rocked or rocks themselves to fall asleep. It's the only way they'll fall asleep. Think right away carcinosin. Hair down the back of the spine. Think tuberculinum. The cervical glands, I've seen this more than once, many times. Tuberculinum, silica, burrita carbonica, burrita muraticum. This was interesting. White spots or gray patches of hair. I've used lycopodium more times for this in children with autism than I could count, and it's been very good. Perspiration on the nose, tuberculinum. There's other remedies there, but tuberculinum is a big one. Natmer is there too. Okay? So that's pretty much it. That's what I wanted to share with you guys. So again, guys, these cases, they need time. If you put the time, you do a physical exam, you get the parents to go head to toe. You look at the family history, you look at all this stuff, you will make changes in these children's lives, and it will happen, and there'll be slow, gradual changes, but nothing else touches what homeopathy could do for these kids. These parents do hyperbaric oxygen therapy, they do functional medicine, they try everything. And we have a tool that is so powerful. If we take the time to take the case thoroughly, it has to be taken thoroughly. Okay, so I hope this was helpful for you guys, and you got a little bit of value out of it from what I learned the last 10 years, from what I've learned from Dr. Devendra, talking back and forth with him, and I hope it was helpful for you guys. If you guys have any questions, we're near the end now. I'll take any questions you guys have or anything I could answer.
If any of the participants are having any question, you can put down in the message query, or we'll also send you the email of Dr. Fernando. So if he has any query, you all have any query, so you can email him directly, like giving the reference that you have attended this webinar, and whenever he gets time, although he's a busy person, but whenever he gets time, he'll reply you back. I also want to thank Dr. Gaurav Gupta. Gaurav Gupta, can you show up on the screen for just for 1-2 seconds? Dr. Gaurav. So Dr. Gaurav has, you can unmute yourself also, no problem. So Dr. Gaurav Gupta is a professor in the college in the, Doctor, what's the name of your college? In the Kekdi Medical College? Unmute yourself, unmute yourself.
I think he's muted, yeah. Doc, maybe make sure he has the ability to unmute. I don't know.
Maybe he is.
Let me see. Maybe I could do it here.
No, only Gaurav Gupta can unmute himself. Okay. I found the call. Okay, so yeah, Dr. Gaurav Gupta has provided us, he's professor in a homeopathic medical college in Kekdi, district of Rajasthan. and he's also my dear junior friend, and from the college days he's one of my greatest friends. And all the technical assistance during this webinar, like arranging this meeting, like arranging all the templates and all the for the webinar, has been arranged by Dr. Gaurav. So we all thank Dr. Gaurav for that, and give him his due credit. So Dr. Gaurav will please like put down your video for a while. Okay.
Yeah. Thank you, boss. Thank
Thank
you.
you, Dr. Gaurav. Thank you
Thank
very
you,
much.
doctor.
Okay.
You're welcome. Thank you.
So I thank all the participants here who have joined and like learning from Dr. Fernando patiently, like for almost 1.5 hours. So on a Sunday night, it's
Yeah.
it shows your dedication of all the
Yep.
participants here, that you have like waited for 1.5 hours on a holiday and to just to learn.
Yep.
So this shows your passion towards the pathy and the cause we are all like working for, like to treat the patient.
Yeah.
And Dr. Fernando, like next time we'll do a webinar with like collaborating you and me, and next time we'll mostly focus on the repertoire cases. Okay. So
Sure.
all the participants are very good. I thank all, and if you have any query, you can put down in the message, or otherwise I just check if there is any query. So right now there is no query. So doctor will like to wrap up, and this wonderful audience. This is the first time the Voice of Homeopathy is conducting a webinar, and I thank all the participants. Thank you all for joining us and listening us patiently. And we all, by our heart, we all thank Dr. Fernando for taking his time. You see, making this PPT and all, it must have taken him more almost a week to do all this. Okay, to arrange all this, to arrange or make the all PPT, to make all the prepare for the webinar. So it takes at least a week for a doctor to, because I do a lot of webinars also, so I know what it take, what time it you have to take out your personal time and then go for especially, and he has done it free of charge for us. So he has not taken any charge. We have not taken any charge from you. So we have done it like free of charge, just to create awareness. Okay.
Yeah.
So
Yeah.
I thank you, Dr. Fernando, from my heart.
Perfect.
And next time, the Voice of Homeopathy will call you soon for another webinar. And next time we'll do it in a, like what we say, in a collaboration way.
Absolutely.
Half for you, half for me. And let's see how things goes after that.
Love that. Okay. Thank you, everybody. You guys have a good night. I hope this was helpful for you guys. Okay.
Yeah. Thank you, doctor. Have a good day.
night.
Goodbye.
Thank you.
Goodbye,
bye-bye.
all the participants. Voice of Homeopathy will reach you soon for another webinar. Goodbye. Participants can share their feedback in the message box.